Hey everyone, so in today's video, I want to talk about Canada's healthcare system, and I want to get right into it. So when you think of Canada's healthcare system, what comes to mind? One of the first things may probably be that it's free for everyone. So many people believe that Canada provides entirely free healthcare, including myself up until recently, but what does this actually mean? So in this video, I want to explore both the truthiness of this claim, which is the public perception of it, and the truthfulness behind it, which are the facts backed up by policies and research. Many common perceptions you hear from the public might include, in Canada, you never have to pay for healthcare, or everyone gets the same level of care no matter who you are. And you even hear things like Canada is better than the US because it's completely free here. So most of these opinions and beliefs stem from political slogans, social media comparisons, and personal anecdotes. But what is the truthfulness behind this? What's the reality? Well, according to the Canada Life website that outlines services covered by provincial health insurance, medically necessary hospital, physician, and surgical dental services are provided. But what's not included? So this is actually a pretty extensive list, including things like regular dental care, vision care, mental health therapy, many prescription drugs, medical equipment necessary for individuals such as prostheses and wheelchairs, physiotherapists, massage therapists, some specialist services, and there's many more. According to the Canadian Medical Association, 28% of healthcare is not government funded. That's a pretty big number. So how do people access these? Well, it's usually out of their pockets. Some Canadians may have additional health insurance coverage through their employers and added benefits, but this doesn't apply to everyone. So, is healthcare truly free for everyone in Canada? I'd like to say not entirely. And there are other challenges to this claim as well. Consider the horror stories you've heard about wait times in Canada. There have been several studies on this, but I want to focus on a study conducted by the Fraser Institute last year that reports significant increases in medical treatment wait times across Canada. In 2024, the average wait time between a general practitioner's referral and treatment was around 30 weeks, the longest ever recorded. And I've added a graph here from the study itself to show the median wait time increases across the provinces throughout the years. This represents one of the big trade-offs of Canada's publicly funded system. While your care is covered, access isn't always immediate, leading to more deteriorating health outcomes and potential economic losses due to the decreased productivity we experience. This segues into the last issue I'd like to discuss. As a solution to longer wait times, Canada is now experiencing the emergence of private clinics, where patients pay out of pocket for expedited services, sparking concerns about a two-tier medical healthcare system. While this may seem like a perfect solution, the Canadian Doctors for Medicare argue that introducing private payment prioritizes care based on financial capacity rather than need, leading to worse access to healthcare. This suggests that while private clinics may offer quicker services to those who can afford them, they raise concerns surrounding equity and the principles behind Canada's universal healthcare system. So, I ask you once again, is healthcare in Canada truly free? Not entirely. It's publicly funded by your taxes, but many essential services still require us to pay out of pocket. Canada's healthcare system is often praised, and there are many positive things to say about it, but it is still far from perfect. Free doesn't always mean accessible, and that's something worth thinking about. So I've linked all my sources in the description down below if you want to learn more about the truthiness versus truthfulness of the Canadian healthcare system, and thank you for listening.